Hey everyone, it's Drew here back at ASAPS 2018. I am joined by the Vice President of the Rhinoplasty Society, Dr. Berkowitz. Welcome.
Thank you very much.
How's the show going?
Well, the show is always, it's always quite a show. A lot of people,
Yep.
a lot of new things, a lot of new ideas. It's where you become stimulated to want to improve your practice. So as they say in Japanese, our motto is Kaizen, always constant improvement.
Yeah, I love it.
You never want to get stale.
That's what they call it, practice, right?
That's why they call it practice. So the rhinoplasty meeting this year was very exciting because we saw a lot of young people who are bringing new ideas into our society, trying to improve the art and the science of rhinoplasty. And one of the problems with rhinoplasty has been that it has been too much of an art, in my opinion, and not enough science.
Okay.
We're seeing more good science.
Okay.
For example, we're taking a closer look at our instrumentation. For the past,
the actual devices?
The actual devices that we use. So this may sound incredulous to some people listening to this, but for the past 100 years, rhinoplasty has progressed in terms of our knowledge of what a nose should look like and what we need to do to achieve those goals. But the instrumentation has barely budged.
Interesting.
In other words, the instruments that we put into our hands, we like to think our hands are the tools. Our brains are the tools.
Yeah.
Our hands are the implements that hold the tools.
Right.
The tools that we've been using are basically from the Iron Age.
Gotcha.
So hammers, chisels, saws.
So talk to me about some of these new tools.
Punches. So starting 15 years ago, I became interested in power tools. I was introduced to it by one of the former presidents of the Rhinoplasty Society, Bauman Gairon.
Okay.
Dr. Gairon is a great leader, and he came up with the idea of using a power burr to help remove some of the bone. I thought, that's what my dentist uses. That makes a lot of sense. And I wouldn't go to a dentist that used a file on my teeth.
Sure.
I would want someone who used power tools.
Yeah.
And that got me started. And I started introducing more refined power burrs, smaller instruments, and finally I got into little power saws. And these work completely differently than the hammer and chisel that has no regard for where it's going. You try to control it. And if you get really good at it, if you do it long enough, you can get pretty good control. But for a young plastic surgeon, that means a lot of patients are going to suffer as the experimental subject of that learning experience. It can take at least 100 rhinoplasties to learn how to do the bony work. The tip of the nose, the middle portion of the nose, those are controlled with sutures and trimming and things that are readily learned. But actually cutting and moving the bones, that takes the greatest skill.
So so control is the big difference then between the power tools and the older instruments.
So about 7 years ago, my dentist introduced me to a tool called the piezo, or the piezotone. It was only available to dentists in the United States at that time. And I had an opportunity to use it on the nose, and I thought, this is even more refined than the older power tools because it functions by means of a crystal that translates electrical energy into motion. And it forms an ultrasonic system. So now we finally had ultrasonic power tools in our hands. The problem was, I wasn't a dentist. I wasn't licensed to purchase that machine. 4 years ago, that machine was introduced into the United States by a company marketing it to neurosurgeons, and I was able to get my hands on it because they were using it on back surgery so you could delicately remove bone without injuring nerves. That's what we need to have in rhinoplasty. So we now had tools that I could cut the bone, and I didn't worry about the tissues that support the bone and around the bone because they were protected. The results have been less bruising, quicker recovery. We can get people who routinely use this. Dr. Olivier Gerbeau has been the driving force of this instrument in Europe and around the world. An amazing man. And he and I have collaborated closely on that. And there are about a half a dozen of us in the United States now that have this equipment. And we've been working together, we communicate with each other, and we're trying to get all plastic surgeons to see the need to move forward into the 21st century.
Right.
The time has arrived.
Yeah, absolutely. So you would say then still at this point you're still in the minority using the power tools?
Oh, by far.
By far.
But at least this year, when we asked the audience, how many of you are using the piezotone, the new piezo instruments? About 6 or 7 hands went up.
Oh,
in
wow.
the past, there were just one or two.
And it was you.
Yeah. So the demand is starting to be created.
Gotcha.
People are learning.
That's exciting.
It takes a long time to get people to move away from their comfort zone.
Sure.
And plastic surgeons who have been doing rhinoplasty for 30 years, they have already mastered the hand instruments. They feel like, well, I don't really need them.
Sure.
But for the young plastic surgeon coming out, this is where you can mark the bone, cut the bone in. It will cut exactly where you mark it.
I love it.
And you are able to get predictable results the first time.
Cool.
And that's what you want.
Yeah.
You don't want people to suffer.
Yeah.
From
No.
that.
You don't want to be the doctor that makes people suffer through 100 patients till you figure it out.
That's exactly right. You know, Drew, entropy is an interesting topic. Entropy is where we watch the deterioration of all things. You see it in photography.
I see it in business.
You see it in your business.
Yeah.
You see the film quality, it deteriorates over time.
Sure.
It looked great 20 years ago, now it's faded.
Yep.
Same thing with rhinoplasty. We have to constantly fight entropy. And a rhinoplasty may look good for a year or two, even if there was a little minor imperfections. But over a couple of years, as the tissues settle, all of the last remnants of swelling have gone down, all of those little things become magnified. And then you have a problem. We're trying to match Mother Nature.
Yeah, that's fascinating.
Not nice to fool Mother Nature.
No.
You really want to respect her.
Yeah.
We're trying to take rhinoplasty past the art stage and pull it into what I call the architectural age. We are architects of the face. We're not artists. An artist has license to do whatever he or she wants to do, which if you want a nose like Salvador Dali might have drawn, okay. But if you want something that is architecturally perfect, the people you should be looking at are Frank Lloyd Wright, Louis Sullivan.
It's a beautiful analogy.
Le Corbusier.
Yeah.
These are people that understood form over function.
Right. Infrastructure.
Form follows function.
Yeah.
Rather. These are the people that understood, like Louis Sullivan said, form follows function. So the nose not only has to look good, it has to function well. Mm-hmm. So that's why it's an incredibly complex project. Architects have to follow, they have licenses. Plastic surgeons have licenses.
Yeah.
We have a license that is limited by what society says we can do. I'm not allowed to make a nose that is split into 2 parts. I'm not allowed to do those things. I would lose my license.
Right.
And I have to follow the laws of nature. So just like an architect, we have to respect those 2 laws at all times.
Beautiful.
And the piezotome has made all of the difference. It's being marketed here by Marina Medical. They're starting to sell them in the United States. It's going to make a big change.
Cool.
So we're excited that young surgeons are saying to me, "Can I come watch you do that?" And I say, "Come on over."
Door's open.
The door is open.
Awesome. Thanks. I appreciate it. Thanks for joining us, and thanks for sharing your insight. Yeah.
Because we're talking about the future in rhinoplasty.
Yeah, I love it. Thank you.